p.m. today, all of Greater Sydney, the Blue Mountains, the Central Coast and Wollongong will go into a lockdown with stay-at-home orders in place until midnight, Friday the 9th of July. So essentially, a fortnight from midnight yesterday, all of Greater Sydney, the Blue Mountains, Central Coast and Wollongong will go into lockdown with stay-at-home provisions. What does that mean? It means all of us have to stay home unless for the four following reasons. Unless we have to work outside the home or get educated outside the home, and given school holidays, that obviously doesn't apply. But if you must work outside the home, you're able to do that. If you need to seek medical attention, including getting a COVID test, getting a vaccine or any other medical attention, you're allowed to. And you're also allowed to leave the home for care and compassionate grounds as well. And obviously, you're allowed outside to purchase goods, essential goods and services. And I know I'll say this, and I please appreciate people following these instructions. There is no need to panic buy. All the shops will be open every day of the week. There is no curfew. You can leave your home at any stage to purchase any essential goods that you need to, and that is a given. So please be thoughtful and considerate about fellow citizens, and no need to panic buy. For the next 2 weeks, you will be able to exercise outdoors, and we appreciate during the school holidays this could be the only time that people are able to gather outside, and in no more than groups of 10. So in the regions that we've outlined, in no more than groups of 10, you're able to gather outside for that recreational exercise. And of course, when you are outdoors in groups of 10, make sure you maintain a good social distance and follow the health instructions. Weddings are able to proceed tomorrow. Obviously today and tomorrow it's both lacks compassion and also not fair to cancel weddings. So today and tomorrow COVID safe weddings will be able to take place, but unfortunately from Monday, for the duration of the lockdown, weddings can't take place. Funerals can take place with a maximum of 100, 1 per square 4 metre, masks indoors. Can I also stress that during this time, even when you're going out to buy food or going about your business or essential work, that every time you enter a business or any premise that you use the QR codes. As you know, the New South Wales government is mandating for QR codes to be everywhere at all times. So make sure, no matter whether it's a temporary purchase, you're going into a supermarket or you're going to grab a takeaway, that you do log into your QR codes, and that's really important. I also want to foreshadow that nobody should feel stressed about their financial situation. Obviously, there are provisions for us, and we will, as a state government, in the next few days, we'll be announcing support to businesses, and also the federal government support to household kicks in at a certain time, and obviously that will kick in. So nobody should feel stressed or pressure to break any of the rules because of their financial situation. The New South Wales government will be there to support businesses, and of course the Commonwealth support to households kicks in as well, and we will provide that information and that detail in the next few days. But in the meantime, I don't want anyone to feel stressed more than we need to, and I don't want anyone to feel panicked about their financial situation. Now, what happens in the rest of New South Wales? Well, regional New South Wales, so the areas that I haven't spoken about, which aren't in lockdown, will have to undergo restrictions that have been in place for broader Sydney. So in the regions, no more than 5 visitors in your home. All hospitality has to be seated, 1 per 4 square metre rule. Only a 50% capacity for outdoor events, indoor mask wearing, and again restrictions in relation to funerals and weddings. So for those parts of New South Wales that aren't in lockdown, restrictions still apply, because we want to make sure that if there have been any occasions where people unknowingly have taken the virus outside into the regions, that we don't have any spread in those regions. Now, Dr. Chan has often said that when you have a contagious variant like the Delta virus, a 3-day lockdown doesn't work. If we're going to do this, we need to do it properly. There's no point doing a 3-day lockdown and then having the virus continue to bubble away in the community. Now, if after 7 days there's a dramatic change in the trend, well, obviously we'll evaluate the situation. But at this stage, the best health advice we have is that a 2-week period, or until midnight the Friday the 9th of July, is necessary in order to make sure we get to our target of zero community transmission, which has always been our target from the beginning of the pandemic. Given how transmissible the virus is, given the extra exposure venues, we know that even the best contact tracers in the world can't stay a step ahead unless we put this in, and we need to do it properly. So there was no point doing it for 3 days or 5 days because it wouldn't have done the job. The best health advice today is that it should be for 2 weeks, but if there is any massive improvement ahead of that time, of course we'll evaluate that. But the best advice we have from Dr. Chan and the health experts is that we should brace ourselves for more cases. We're finding that all household contacts, unfortunately, are getting the virus. Transmissibility is at least double what previous variants have been. So we do need to brace ourselves for potentially larger number of cases in the following days, and that's why it's so important we take action now. We always take the best health advice in New South Wales, and this is the best advice we have. And please know that we'll get through this. It's never easy when all of us have to face these circumstances, but we're all in the same situation. We've had to do this before. We know the drill. And I'm just asking everybody not to cut corners, because if just a handful of people cut corners, all of us end up in a very difficult situation. I just want to thank everybody for your patience. I want to thank you for trusting the government. We trust our people. We trust our people to do the right thing. And we hope that at the end of the 14-day period, or July the 9th, we all look back and can feel proud of the way in which we all came together and responded. I'll now ask Dr. Chan to reinforce the messages she wants all of us to hear as our Chief Medical Officer. And I do want to thank her and the team. Our contact tracers have been amazing. But when you uncover just one case that's been to a number of venues for a couple of days, that is a huge risk under these circumstances, and that's why we're taking the action we are. And after Dr. Chan reinforces the messages, Minister Hazzard will say a few words. And obviously, I'll just make this point as well. If you are from regional New South Wales, currently in those areas that are being locked down, you have to sensibly make way back to your homes, but you have to keep yourself isolated for 14 days. And I'll ask Dr. Chan to repeat that message to make sure that if anybody unintentionally has the virus and goes back home, that they self-isolate for 14 days to make sure that it doesn't get out into the community. And after Dr. Chan gives her update, Minister Hazzard will say a few words and then we'll take a few questions. Thank you.
So the key message is we do not want to see, we need these measures in place. We need these measures in place to allow us to bring this outbreak under control. As the Premier has indicated, the contact tracing and testing numbers, despite them being quite high, the testing numbers, and the contact tracers getting in contact with people rapidly, what we're seeing is by the time we've got there and uncovered these chains of transmission, we have had a number of people infectious in the community. Given we are aiming to get to no community transmission, and as we roll out the vaccine, it is important that we get to that as quickly as possible. So the restrictions need to be applied absolutely, and it's critical that we all comply with them if we are going to achieve that no community transmission, and the duration of the lockdown remains at that around that 14 days. Also, it is important that we do not cede our regional communities. So anyone who has been in Sydney, Greater Sydney, from the 21st of June, we're asking you to stay at home for 14 days since you've left that area. And the reason for that is we want to make sure that you minimise your transmission risk to anyone else. As we are now uncovering, it might be that you're out in the regions but you haven't been aware yet that there was an infectious person there. So this is a prudent precaution to stop those regional seeding events. Also, you are permitted to go to work and leave Greater Metropolitan Sydney for work and essential reasons, as the Premier has indicated. Please do not risk it and say, oh, I'm going to go, I really have an essential reason, or my work is essential. Please consider that. We want to maintain essential workers to going into those areas, but they will be subject to the stay-at-home provisions when they get there. And please don't try and shortcut or in any way sidestep the rules. As the Premier has said, if we all work together, we will have the greatest confidence in bringing this outbreak to its conclusion as rapidly as we possibly can.
I just want to emphasise that the concerns we have at the moment are extremely high. The Delta variant of this virus is certainly moving around our community far faster than anyone could have imagined, and it's now up to all of us to fight back. We can fight back by taking simple measures. Just following the instructions that our Chief Health Officer have given is potentially the answer. I want to also emphasise that the point that we don't want this virus, this very dangerous virus, to get into our regional communities. We know it's already circulating here in parts of Sydney. We don't want it into the regional areas. As you'd be aware, there was some fragments found in the Burke sewage system. We are concerned that people may have travelled out into the regions. If you are out there in the regions, as the Chief Health Officer said, from the 21st of June onwards, stop wherever you are and isolate for the 14 days since that period, since you left Sydney. I also want to stress to the employers in New South Wales, there is now going to be a health order. There is a health order which actually sets out that your employees, if possible, should be working from home. That's a clear requirement to stop the movement around our community. So again, I apologise to the business sector, but I think we found that we can be extremely productive with our workers working at home, and certainly to allow them to do that will minimise at least one group of people from moving around unnecessarily. Finally, I just want to say this. The emphasis now is to defeat this virus. We all need to stop moving around unless we absolutely have to. Don't play games with yourself and with the community. Please stay at home unless you really need to go out or you have one of those 4 reasons, and even then, think twice before you do it. Thank you.
It was acknowledged even this morning that there were cases that have been out in the community for days while possibly infected. There's probably a sense of the community as well that they were ready for a lockdown for the last few days. What would you say? Why didn't this lockdown come any sooner?
Look, we have to follow the best health advice when we get that health advice, and that's exactly what we've done. New South Wales always has a policy of not burdening our citizens unless we absolutely have to. But unfortunately, at this point in time, we absolutely have to. This has been, the last few days have shown an outstanding level of response from community coming forward and getting tested, but also from our contact tracers. I mean, our contact tracers have been able to get on top of various cases and their close contacts within hours. But once the number of exposure sites goes outside our area of concern, and once the number of exposure sites increases, it starts to become extremely difficult for our contact tracers to stay a step ahead. Unless you stay a step ahead of this virus, it can very easily get out of control. And that's why we've taken the health advice every step of the way. But this morning, when we met with the health experts through our Crisis Cabinet Committee meeting leading into the afternoon, it was explained to us and quite evident to us that we needed to act based on that advice, and that's why we have. And I just want to thank the community for being on this journey with us for now nearly a year and a half. We've done so well to date, and whilst it's very disappointing that all of us have to face the next 2 weeks in the way we need to, I think all of us understand the unique circumstances in this case. The absolute contagious nature of this variant, and the fact that the exposure sites are now outside our area of concern. Now, the northern beaches, geographically, we're able to isolate that off because obviously it was a geographic region which could have been cut off, but also the virus then wasn't as contagious to our understanding as what this variant is now. So there's 2 things going against us on this one. That is the fact that it's very difficult to geographically shut down various suburbs without people working and living having infected or transmitted the virus elsewhere. And secondly, the best advice I've had from health experts today is that the transmissibility is at least double previous variants that we've seen. And unfortunately, this variant is becoming the main variant. So those factors have led to the health advice that we've been given, and that's why we must act. We didn't want to wait hours. We didn't want to wait till tomorrow morning. As soon as Dr. Chance said that she needed to advise Crisis Cabinet of the evolving health situation, we took action. I didn't want to wait hours. As soon as Cabinet Crisis was advised of the evolving health situation, presented with the facts, we acted quickly within less than a couple of hours. Sure. I'll let Dr. Chant explain, but for example, just in the last couple of hours we were advised that potentially there are a couple of cases that have been active in the community outside the areas of concern for a few days, and that was enough for us to have to react. But I will ask Dr. Chant to make that assessment.
So the situation really has evolved very rapidly over the 24 hours, and as I'd indicated, it's because we've found an unrecognised strand of infection. So when we've tracked back the movements of a case which provided the missing link between those exposure venues, we do the contact tracing, and what that has unearthed is a large number of cases. And those cases were infectious in the community. So it's not necessarily we're behind in the contact tracing. What we know is when we've got to those individuals, they were in fact had been infected and infectious in the community for a number of days. That's why the concern is there, that we now know that there have been a lot of people infectious in the community, and that has come out of this unearthing this chain of transmission, a workplace cluster, and other cases arising and linked to that transmission.
On the cases, how many people have been hospitalised?
I'll have to update you with the latest. I'm sorry, don't have that, but we do monitor that.
No exemptions in that sense. There are very clear reasons why people can. There are very clear reasons why people can leave home. Please don't try and manipulate beyond that. When you do that, you might feel self-satisfied for a moment or two, possibly even for a little longer, but you won't feel as satisfied if you spread the virus. So please do not do that. Can I also emphasise these masks are our weapon. These masks are one of our weapons against the virus. And I've noticed, as have our health authorities, that not everybody is wearing them fully over the nose and the mouth. Please make sure that you actually wear them over your nose and over your mouth when you're out and about. The aerosols can come from your mouth or from your nose. Take that seriously, please.
Minister Hazard,
Yeah.
can you please clarify as well what these discounts are with any businesses? Some retail stores are going down the roof, or do they all need to shut their doors?
No, we've made it very clear that retail stores can be open, but obviously we're expecting the community to go out only for essential buying. So one would expect that that might be, for example, going and getting your groceries. You may need to go and buy some blankets, you may need to get clothes. There are other issues that you may need to do, but don't loiter. Don't go for a wander around the shopping centre that might have a number of shops open. Just use your common sense. I think that's the message to the community. And I've got to say, we saw this last time around, particularly in the Northern Beaches, but we've had other similar situations. The community have been fantastic. Shops that clearly don't fit into the essential category don't have to open. One would think that some items that some people might call essential aren't necessarily. I'm not sure that essential oils, for example, would really be essential when you can catch the virus and spread it around. So hopefully common sense will prevail, and I'm sure it will.
Minister Hazard, you said yesterday that you felt like you had your hands tied behind the back because of the shortage of vaccines available.
Yeah.
Have you had any joy on that front?
Look, clearly the federal government went out to try and get vaccines at an appropriate time. They've made the purchase acquisitions that are being distributed across all of our nation. What we know in New South Wales, though, is that we could actually use a lot more vaccine, and if we had it available, obviously that would help. But I think we've got to also just look at this rashly and sensibly. That the whole world wants vaccine at the moment. There are nearly 4 million people who have died from this virus, and of course it's probably as bad as it's ever been with the various variants that are now floating around through the nations. So everybody's after vaccine. We've just got to say, well, yes, I would love to have more vaccine as a health minister, but I understand why it can't necessarily be the case at the moment. I think most people with little kids would know that that is essential.
Also, just first day of school holiday today, some families in Greater Sydney may have already left to go to the regions they have to go right now.
Okay.
I'll let Dr. Chan answer that because I can hear she already is.
Sorry. Those individuals, if they've been in Greater Sydney since the 21st of June, will need to follow the stay-at-home orders, so they will be for that period since the 14 days since they left.
So if they're on a family holiday in the regions, they can stay there, but they just can't go to any restaurants.
Restaurants and other activities. They can go and buy food and groceries and enjoy the outdoor environs, but they can't go to hospitality and other venues.
What about
Sorry, Susan, say that again. We don't normally talk about what the Cabinet decisions are, but on this occasion I just want you to know that every member of the Crisis Cabinet was rock solid on this. You know, as we were sitting this morning in the conference room here in Health, the numbers were being written up on the board from this morning. That gives everybody a real sense of the imminency and urgency and danger that we're facing. And there's no doubt about it that we have the best public health officer in the country, Dr. Chant, and her team. That's not just Dr. Chant, it's her entire team who are giving us that advice. And yeah, there's no doubt about what we needed to do, and we're doing it. They should expect us to do.
Minister Hazzard, to clarify, I know we talked about childcare for early learning. What about for parents who are essential workers who can't be home over the school holiday break and perhaps have organised school activities for their children? Is that...
I was going to answer that, but Dr. Chant's already answering it, so I'll invite her forward again. No, go, Dr. Chant.
No, yes, you go and answer that.
The answer that Dr. Chant just gave was yes.
While you're clarifying, Prime Minister, elective surgeries...
Everything's proceeding on that front. We're not taking any steps on that. The last time around when we had the reductions in elective surgery, it was a National Cabinet decision. And at that point, of course, we didn't have the sorts of capacity we now have in our hospitals across New South Wales or anywhere in Australia. And we had seen the forecasts, and we were very keen to try and make sure we had full capacity through getting more ventilators and having staff available. At the moment, that is not the immediate cause of concern because we have all of that equipment. What we want to do is just keep people safe. That's pretty simple. Keep people safe, and the people who can keep people safe are actually all of the community in New South Wales.
Minister, the Delta variant is more transmissible, but is it more deadly?
What we know is it's definitely more transmissible, and the early evidence is it could actually cause greater difficulties for individuals. So we are taking a precautionary principle. None of this science is exact at the present time, as you'd expect, because it's evolving across the world.
Premier, it was revealed yesterday that members of your staff are close contact. Are you able to reveal which members are close contacts? And also, are you aware of any ministers who have sought to have their classification from close contact to casual contact revised now?
Yeah, look, I'll ask Dr. Chant actually to finish that line of questioning, but I will say this, that unfortunately a number of my staff have been identified as close contacts. Fortunately, I wasn't there when that occurred, but a number of my staff have been identified as close contacts. But as Dr. Chant will say, there is still a category of people within all locations, including Parliament House, who health is working through to determine if they're close or casual. At the moment, as an abundance of caution, people are being deemed to be close until they've been deemed to be a casual contact. But I'll ask Dr. Chant to finish that.
So the usual process our contact tracers have gone through is that we err on calling people close contacts until we've had the opportunity to, or ask people to isolate and stay isolated until we get back to them. So because of that, there were a number of ministerial staff who we originally classified as close contacts, and then what we're doing is going through a vetting of the case notes will determine whether in fact they were close. So we're reviewing everyone's the notes from Adam Marshall about where he went, and then separately interviewing them. But often this is what we do in where we don't have any clarity, and you can imagine that there were a large number of people we had to contact, trace and assess. We just ask you to classify you as a close contact, tell you to do that, and then we'll work through the detail. And progressively we worked through, the same thing applied into in relation to the parliamentarians. where we went through and determined close contacts and no contact and casual contact, and sometimes there might have been someone that we thought normally sat in the Parliament that day, but then when the video CCTV footage was checked, that person wasn't present at that time. So you can imagine that sometimes we just group text people that we think would have been there, and then we have to work through this iterative process. We are much better to be very inclusive of people, just because we want to reduce any risk of transmission. And with this Delta virus variant, we cannot take any shortcuts, and hence that is why people have gone from being close to casual. And if new information has arisen, some people went from casual to close. So the movement has occurred in both directions.
Dr. Chan, might I clarify, the Marrickville food wholesaler and the other sites that were outside the 4 LGAs that were already in lockdown, are they a new cluster, or have they been linked back to one?
They're linked back. So the Marrickville Great Ocean Foods is actually linked to the cluster. So we have clear links. So one of the key characteristics of this is that we've got the links, but when we're finding the people in the links, they've already been in the community infectious for a number of days, and they've actually been infectious in settings outside the area of the original lockdown. And this was a very rapidly evolving picture that came to light as we've unearthed the testing around this unrecognised case, and that has been the real reason for our escalating concern, which we've conveyed.
Dr. Chan, those rules that you outlined that apply to parliamentarians, also apply to health and the Premier, etc. Is there a different standard?
No, there's not a different standard at all, and I've got to say the same process applied no matter who it was. We assessed the individuals, and one of my team spoke to all of the individuals after reviewing Mr. Marshall's transcript, and then he's had to answer many questions that have gone back and forth with him to clarify. So that is the assessment process. Obviously, when this was evolving, we took a very cautious approach. And I myself provided the advice that for the absolute surety the Minister should take the action he did for the abundance of caution, and then I referred it to my staff to undertake the interviews, having access to Adam Marshall's movements and what he indicated were his close contacts, to reconcile them. And as I said, there's been people that have gone from no contact to close contact to, because you can imagine that people's recollections are not perfect. Obviously, we've got the advantage of CCTV footage, and we've also got some triangulation of reports from both Mr. Marshall, but also other people that may have been present at key meetings where we might have been concerned about transmission.
Premier, you said that if after 7 days there's dramatic change in the number of cases, you'll reassess. You also said that you're aiming for zero community transmission. What if at the end of 2 weeks we haven't achieved zero transmission? Will you then reassess extending the lockdown?
Look, we'll obviously take the best health advice. The best health advice we were provided with today was that we would need 2 weeks in order to get on top of the community transmission of this very contagious strain. That's unlikely. However, we could assess after 7 days, but I want to be very upfront with the public. This will be, for all intents and purposes, a 2-week lockdown. I don't want to take away from that, but if there is a dramatic change and the health advice says we can get out of the lockdown earlier, but I'm not anticipating that. The best advice we have from health, in fact, is that we should brace ourselves for additional cases. We should brace ourselves because the contact tracers have done such a good job in identifying potential cases and their close contacts. Just from those numbers alone, and how transmissible the virus is, we know that the numbers will go up the next few days. So I just want everybody to brace themselves, not to be scared, because we're taking the right advice, we're doing the right things, but the best advice we received today is that it will take 2 weeks, which is why the lockdown has been extended to midnight Friday the 9th of July.
Will you be policing the roads so people don't flee?
Yeah, so certainly we do rely on people following common sense as well as the health orders. So whilst police will not be afraid to throw the book at anybody who does the wrong thing, we've seen many examples where unfortunately one or two people choose to do the wrong thing and it hurts all of us. But I have absolute faith in the vast majority of our citizens in New South Wales. I've just been blown away by how much everybody's respected the health advice, listened to the health advice and followed the health advice. And I just appeal to everybody. I'm as disappointed as everybody else about what we've had to do, but we've only done it because we absolutely had to. We're all in it together, and I'm also confident that together we will get through this as quickly as we can and come out of it stronger and moving forward in a confident and optimistic way.
The leading theory is that this outbreak started from the limousine driver. Have you spoken to him?
No.
No plans on speaking to him?
No, it's not my job to do that.
Okay. We have to believe that it's not him.
Yeah, well, look, that's why, can I just say, Dr. Chant always says, health is always open. Health is always open to all theories that may exist. So I'll ask Dr. Chant just to provide an update on that. But we shouldn't firstly attribute or not attribute anything unless we have the evidence. And I'll just ask Dr. Chant to see if she has any update on that situation.
So we have no information before us that there was a case that was predated this individual. Remember, the Balcombe Hills gentleman did actually have symptom onset prior to this gentleman, but he was concluded to be a false positive case, and there were no established links between that gentleman and this gentleman. And all of the household contacts of the gentleman at Balcombe Hills, including the workplace contacts, were negative. Serology and extensive investigations concluded that was a false positive, and I think at the time we had concerns and expressed them openly that we couldn't conclude whether he was a false positive or an old infection. We continue to do the genome sequencing and look at any genome sequencing that's uploaded to find any other source, and all of the cases in the outbreak will be genome sequenced. Obviously, we're open to any hypothesis, and if the individual wants to put forward who they got infected from, we're happy to track it down. But at this point, we don't have any other leads. At the moment, given where we are in the cluster investigation, our real focus is downstream contact tracing and making sure we're on top of that. But as I said, we're happy to pursue other avenues. But at the moment, that's our clear priority.
Dr. Chan, why is the Marrickville food wholesaler and delivery drivers going out whilst infected so concerning? Are you worried about rest or curves, or is it people that may have eaten the food or been infected?
Okay, so what I'm worried about is and again, we put out this information really early. What concerns me is that we know that the infectious period dated back to the 21st. So with this Delta strain, we know that we are getting positive cases within 24 to 48 hours after the exposure. So if someone's gone into that shop, or if that person has a food delivery driver has gone out and done a delivery. Now, if that delivery was touchless, just handed it across, it was an open area, the risk is quite low. But if the person was a chatty delivery driver, or had interactions, or went into the cold room and put the product in the cold room and was there for some period of time and reorganising, all of those elevate the risk. So what concerns me is any people any cases that might be generated, but there's already been time for those people to become infectious. So that's why we're asking them, their households, to go out and get tested. It may be a bit of over-testing, but it allows us to get ahead of that curve, because we don't want to have a sequential situation where we test the person who's received the food, that person's positive, and then we get to the next people. We're trying to gain every hour in terms of the response, because we do not want to see I understand the impact that the provisions will have on the community, and we want to do our part in making sure that we get on top of this outbreak as soon as possible.
Can I just add something else that I forgot to add before, just by way of clarity for the community? The Premier's clarified that weddings will proceed just for this weekend out of compassion and care for those people who organise the weddings. but obviously people should exercise great caution at those weddings. Same issue applies. Community sport. We had yesterday hoped to be able to continue community sport, but it's become evident with the new cases that we've seen coming in today that that can't continue. So just make sure that people are aware tomorrow community sport and for the remainder of the period community sport is off. And also answering your question before about whether it will be policed in terms of regional travel. Yes, the police have made clear, Deputy Commissioner Walboys has made clear that police have been tasked to be on the lookout for any vehicles that may have come from the Greater Sydney area, and I remind you that they have all sorts of technology these days, including recognition of number plates. And finally, I just remind the community that, well, actually, I also remind you that the regional communities are very aware when they see someone from out of town arrive, and they'll make sure the police know. And finally, I want our community to understand that take it seriously, because if the police officer detects that you're there and there's, say, 5 people in the car, that's potentially, if he decides you're going to go to court, $11,000 times 5 maximum fine, $55,000, and each of the individuals could end up, if they go to court and the court considers it's appropriate, having a 6-month jail sentence. So take it very, very seriously.
Premier, do you fear that the worst days of this pandemic is still behind?
I'm sorry, I didn't hear the last part of the question.
Premier, do you fear that the worst days of this pandemic for us is still behind?
Look, unfortunately, what this pandemic has demonstrated is that we don't know what's around the corner. But what I do know is that New South Wales has some of the best contact tracers in the world. We have the best public health officials anywhere else. And I also know that our people are resilient and will be able to deal with any challenge that comes our way. But what this strain of the virus has demonstrated is that no matter how good your systems are, no matter how good your contact tracers are, no matter how compliant the population is, that we're dealing with an extremely contagious and difficult pandemic. And all we can do is make sure that we take forward the learnings and make sure that we work hard to keep our citizens safe, but also to keep our economy as open as possible. And I can't predict what the future holds, but I do know that I'd rather be in New South Wales than anywhere else in the world. Thanks, everybody.
Thank you, everybody.